Welcome to Nerdy and Flirty, a podcast designed to help you create a life that you love. It's nerdy with science-backed information, and it's flirty. It's fun, it's quick, it's straight to the point. My name is Cass, and welcome back to the podcast. Today, I have a very exciting guest on for you guys. This is someone that I had so many questions for. He went to Rutgers University. He received his degree in kinesiology and exercise science, to then go on to Sherman College of Chiropractic, where he is a licensed chiropractor. He specializes in upper cervical spine, which we'll get into, and he definitely puts the nerdy in nerdy and flirty. This episode is full of so much information that you probably want to get a notebook out if you're interested in chiropractic or just have questions at all. We're going into red flags for chiropractors, things to look out for, what is cracking, and everything you need to know about seeing a chiropractor and taking care of your nervous system. I am so excited to welcome Dr. Mason Shuemate to the podcast.
Thank you, Cassidy, for having me today. Hello again, my name is Dr. Mason Shuemate, and I'm an upper cervical chiropractor here in Buena Vista Township, New Jersey, where I was born and raised.
So first of all, I need to know, what even is upper cervical spine?
So I'm glad you asked. It's a great question. Upper cervical chiropractic is a model that is based on the top two bones in the neck. So your C1, which is we call your atlas, or C2, your axis, and in relation to your skull and the implication that your brainstem has inside of those two bones. So your brain connects to your brainstem, and your brainstem comes down in through like the little hole in your skull, your foramen magnum, and it sits right in between your C1 and your C2. There's a lot of big implications when it comes to your brainstem area because we don't want any pressure on your brainstem. So when you have pressure on your brainstem, that can be not very good for your body. Something a little more different about the upper cervical region compared to the rest of the spine is that it's the only two bones in the spine that don't have a disc between them. So the only thing holding them together are muscles and ligaments and tendons and things like that. So what enables us to do like 80% of our head movement, that comes at C1 and C2. So they're super, super freely movable. But when you have a joint that is freely movable and there's a lot of range of motion in that joint, it's not very stable. So we need to have that area be nice and stable the best that we can. When that area subluxates, it can cause a cascading effect down the rest of the spine.
Are you seeing, this is completely off of our outline, but it just made me think of it. Are you seeing a lot of people with tech neck? Like, is that a thing that a chiropractor would see?
So yeah, definitely a bigger problem just with the generation of being on our phones, and a lot of, video games is becoming a lot more popular with streaming, and people are just on their devices. They're sitting at a cubicle, they're bent over. And yes, tech neck is a real thing. Loss of the curve in the cervical region. I see that all the time. Like, I'll take an x-ray of someone who's like 20, 25 years old and their neck looks like they're 50 or 60 years old. Ooh. And it's like, if I didn't see other things, I'd be like, oh yeah, that's like an older person. But no, it's definitely a problem, but we can definitely help that in the chiropractic world. It's not going to happen overnight, but because you got to understand it's taken you however many years to get you to a certain point, whether that's tech neck or whether that's you have scoliosis or you have high blood pressure, like a bunch of different conditions or structural presentations that the body takes a certain amount of time to get to that point. It's going to take a certain amount of time to go backwards in the opposite direction and get us geared back into a healthy path.
So what is a chiropractor? Let's go back to that and break it down. What does a chiropractor do? What is your job as a chiropractor, and how does it help?
So similarly to you, my mission is to live and promote a healthy lifestyle, except the way that I do it is by optimizing and maintaining the integrity of the central nervous system. So I'm going to say that again because you're not going to hear this from many chiropractors, but this is the absolute truth of what it is that we do. We optimize and we maintain the integrity of the central nervous system. So what does that mean? So the central nervous system consists of your brain and your spinal cord. So how the body will work is your brain is going to send signals down your spine, across your nerves to each and every single part of your body. Every muscle, every organ, every gland has a nerve that goes to it. So as long as those signals can get through back and forth, your body's going to function properly. You're going to be as close to 100% as you can possibly be. How the body breaks down is when your spine misaligns to an extent that the body cannot self-correct it. We call that a subluxation. So a subluxation is basically when the bone comes out of place, puts pressure on the nerve, and blocks those signals from getting through from your brain to that body part. So that's how your body begins to break itself down, act unusual. You might get some symptoms, and then later down the road, you might get some pain, things like that. So my job as a doctor of chiropractic is to check your spine to see if you have any of those misaligned bones, any of the subluxation in the spine, and just adjust them back into the proper place. So this way, those signals can get through from your brain to your body, and then back to your brain, freely flowing, no one's touching it, there's no interference, And that is what is going to enable you to live the best life that you possibly can. When your nerve flow is functioning at 100%, your body is functioning at 100%. Everybody wants their body functioning the best that they can be. So,
especially now, I feel like everyone's all into health and wellness, and this is just one part of that.
Right.
So when you say subluxation, right? I said that right?
Very good.
You're misaligned, and then you align it, right?
Yeah. Subluxation, bone comes out of place, puts pressure on the nerve. We adjust it back into the proper place.
And we're really going to make this simple. Is that when you're cracking? Like, what is cracking?
We typically don't use that word, but you hear that a lot in chiropractic, the snap, crackle, pop, that sound that you hear when you're getting adjusted, because that's the word we like to use. The sound that you're hearing is basically just when that joint space opens up, that's nitrogen gas bubbles just leaving the joint real quick. When you crack your knuckles, things like that.
And it doesn't make your joints swell up?
No, it doesn't make your joints swell. I don't know where that came from.
I grew up hearing that when you can't crack your knuckles because it's going to make your joints swell,
right.
And then you're going to have fat fingers the rest of your life. And even now, I accidentally will crack my knuckle, and I'm like, oh no, I'm going to get fat fingers.
It's over for you. No, I actually, it's funny. I remember hearing that growing up as well. Don't crack your knuckles. You're going to get arthritis, like things like that. I just remember hearing of like a study, like maybe like 5 or 10 years ago, where there was this man who cracked one hand, like all the knuckles on one hand every day for 30 years. And then like didn't do the other hand. The hand that he actually like was like cracking, I'm using air quotes here, people. That was the one that like was good and had range of motion and it was all good. And then the other hand like developed arthritis, which is so weird because it's not what we were taught. But that's totally a myth. So
that's actually so interesting to hear that. That makes sense, I guess. So then tell me, is cracking ourselves or adjusting ourselves a good thing? Like, should we aim for that or not necessarily?
Right. So another good question. I get asked this quite a bit, just about like self-adjusting. Is it good? Is it bad? Is it not a big deal? Basically, the answer that I give everybody, because like some chiropractors will be like, don't do it under no circumstance, like that's bad, and then they don't go into any more depth than that. So what I will say is like, if you're going through normal range of motion, let's say you're stretching, or like you're doing like you're like a deep stretch, or like you're doing yoga, or you're laying in bed and like you cross one leg over the other one and then your hip pops, like that's it's whatever, it's not the end of the world. That's just your body doing what it needs to release in that moment, I guess, so to speak. But it's not bad. I would stay away from like the neck, especially the upper cervical spine, because number one, you have no idea, like when you are self-adjusting, you have no idea in what direction, with what vector, with what amount of force, like you're moving these bones. If you're already under chiropractic care, that can kind of undo some of the chiropractor's work. But what it is when you are like self-adjusting, especially if you're like trying to like force a bone, like you feel like something really needs to go and you're about to crack it, and there it went. So when you get that, what's happening is when you have a subluxated vertebra in the spine, right? Let's just, for example, we'll say C4 is the subluxation at hand. C4 is fixed, right? It's hypomobile. It doesn't want to move. So that means that the joint above it or the joint below it or both, they become hypermobile. So they move a little bit more than they normally would. Your body's telling you, I guess, in that moment, I need to adjust the C4. I need to self-adjust right there. You're not actually adjusting the C4. You're adjusting the C3 or the C5. And that joint is just so much easier to move, so it opens up a little bit more, and that's where you hear that like pop.
That makes a lot of sense, actually.
So it's not bad, but you're not fixing the problem at hand. So it probably feels good because when you are doing that, you're releasing like endogenous opioids like inside of the body, travels to the brain, turns that pain signal off, says that it feels good.
But then it comes back usually.
But then, it'll just keep coming back. And that's why, you want to go get checked by an actual chiropractor and get that C4 adjusted or whatever else.
Okay, that's really good to know. Who needs to see a chiropractor? Is it only people with back pain? Only people with neck pain? Tell us.
Okay, so short answer, who needs to see a chiropractor? Anybody who has a spine. Every human on this planet, they come into, on a daily basis, they come into physical, chemical, and emotional stress. So those three pillars of stress are inevitable in our life, just the world that we live in. It's every single day. We're always going to come into contact with that in some volume or another. So this stress that we come into contact with gets stored inside of our body and expressed in different ways. So it's up to our body to self-regulate these stressors in a way that enables everything to still function at its maximum capacity, even though we're having so much stress. When the body's no longer able to self-regulate, that's when it begins to slowly break itself down, and dysfunction is now present in the body. And it doesn't always show up as pain or symptoms right away, or the development of like a condition. You don't get that right away. So for example, I use this comparison all the time, and people that say, oh, like, my back doesn't hurt, like, why should I go see a chiropractor? Most people that have a heart condition, they don't know that they have something wrong with their heart until they've had their first heart attack or their first stroke or something along those lines. And then they're like, oh, well, like my heart didn't hurt, or like my brain, like itself didn't hurt, so I'm good, right? Like, no, that's not exactly how that works. So it's a preventative measure in healthcare that you don't really get anywhere else. Just talking about chiropractic here. We want to keep your body functioning at as close to 100% as possible. That way, later down the road, you're not running into those pains and symptoms and, arthritis or decreased range of motion or, migraines. Like, all these things can be kept at bay if we just improve what the body already has to offer. Because the body already knows how to do everything, right? I talk about this all the time, that the body is a self-healing, self-regulating organism. The natural laws that are just governing the body from within, they need no help to work. They just need no interference. So what we do as a chiropractor, we just remove the interference so the body can work better. I don't have to tell my heart to beat or my lungs to breathe air or my stomach to digest food or my skin to heal a paper cut. Like, my body already knows how to do all of those things. But if I have nerve interference somewhere within my nervous system that's blocking this, or that, in some regard, it's not going to just shut off 100% of nerve flow. But, when you slowly diminish that nerve flow over time, that's when things can begin to break down.
What are examples of interference, like overtraining in the gym, like things like that? Things that you like hurt your body with, or?
So those things can contribute to interference, but when I say interference, I mean nerve interference that's coming directly as a result of like vertebral subluxation. So when there's subluxation in the spine, that's blocking those signals from getting through from your brain to your body. That's the interference that I'm talking about.
Oh, like being out of line.
Right.
Okay.
So especially at the level of the brainstem, because the brainstem is literally like the circuit breaker for the entire body. Like, there's so many nuclei that sit in the center of the brainstem that control just about every regulatory process that you could ever think of. That's our life force, right? The brainstem is really our life force for the entire body, and all the messages that the brain creates have to pass through the brainstem. So if the brainstem has being like choked off, so to speak, if there's pressure on the brainstem via C1 or C2 and upper cervical subluxation, that's going to affect the output to the rest of the body. Mm-hmm. And that could be different for everybody. Like, you could name 100 different conditions. They could all come from a brainstem subluxation or a subluxation in the upper cervical region. And that's why it's not my job to diagnose or treat or cure. Like, we don't do any of that. Like, all we do is we check the spine, we adjust the subluxation, and we give the power back to the body. We let the body do what it knows how to do, free of interference. That way, then later down the road, my headache went away, or, I'm sleeping better. Like, my gastric reflux went away. I don't have this autoimmune condition. Like, I didn't do any of that. Like, I didn't cure it. I didn't cure you. I didn't fix you. Like, so that's another topic.
What are some of the most common signs that you see that people are complaining about that like clear as day, you're probably out of line? Like, do you know any? Or it's different for everyone?
I mean, yeah, it's different for everyone. As far as like complaints though, are like, yeah, okay, you probably need to like go get checked. Really bad, headaches, migraines that like last or come like at the same time, like all the time. Like, if someone's complaining of like headaches for like years and years, and like they have gone to like see someone and like try to get it fixed or something, but nothing's helping, that's typically when it's like, okay, people use chiropractors as like a last resort option because, they go and they try PT, or they go and they get injections, or they get surgery, like if they go that far. But a lot of people just don't know though. So I'm glad I'm having the platform to just talk about this today, because it is a preventative form of healthcare. If we can avoid like all that horrible stuff down the road that you would have to do to your body as far as surgery is concerned, that's what we definitely want to do here.
Yeah, like ideally for it to work in tandem with your traditional medicine and everything like that.
Right. And here's another thing, which we'll get into in a little bit, but like a common misconception with chiropractic is that like chiropractors like hate medical doctors. And like that is not true at all, 100%. We love our medical doctors because there's a time and a place for medicine to be applied, right? Mm-hmm. And there's a time and a place for chiropractic to be applied. And it's just my opinion that chiropractic should just be like the norm, Why would I have to wait until I'm down bad and then now I have to go to the medical doctor to get whatever it is fixed or taken care of? This whole time I could have just been going to the chiropractor like once every 2 weeks or once a month or once every 2 months, like whatever it is better than nothing. Mm-hmm. And that be enough to keep me out of like the doctor's office. Yeah. And we see that a lot with like children too, which I love. pediatric chiropractic. I have a couple good friends that are really big into pediatrics. From a very early age, the development process is literally consistent upon how good is our nervous system developing and functioning, right? So if I can step in as the chiropractor and just check that child or the children to see how their body's doing, how their development is, just structurally looking at their spine, if I know that their nervous system is freely flowing and unimpinged and stuff like that, then I know that child has like the best possible chance for life. This goes all the way back to birth. So we're kind of going to get on a little, what do you call it?
Tangent.
This is a little controversial. So take what I say with a grain of salt. I don't know anything, whatever. The birthing process is very traumatic. So when a baby is born, it's a traumatic process, both for the child and the mom, but we're just going to talk about the child for right now. What's considered like normal obstetric practice can still be very like physically traumatic to the upper cervical spine of the baby, because whether it's a vaginal birth or C-section or whatever, when they go in and they try to pull the baby out, whether by hand or with forceps, they're grabbing and they're twisting and they're turning of a neck that has not yet fully formed, and all of those muscles and ligaments are just so weak, and they're at the bane of this like delivery nurse or whoever to have that baby's best interest in mind. And some of them do, but sometimes they don't. You can be born into this world like not off to a good start because of like that damage that was done at birth.
That's so true. I mean, how many babies, like I, for example, had a broken collarbone right at birth because of just how hard it was to get me out. My brother had something going on. My other brother had something going on. Like, they just want to get the baby out as quick as possible.
Right.
And it's not always in the best way, I guess.
Another quick thing, people ask me, like, how young is, like, too young to, like, have your child go to a chiropractor? My answer is, like, as soon as they come out.
Oh my gosh.
As soon as they come out. Like, I mean, I know plenty. I mean, hundreds of chiropractors. I mean, there's more than the 100 that I know, but they're there for the birth of their child, and as soon as they're born, they get checked, and if they need to be adjusted, they get adjusted. If they don't need to be adjusted, everything's fine, then we leave them alone. But that's why we call it like checking and adjusting. So I'm just going to check your spine to see if and where you need to be adjusted, and then we'll adjust it properly.
And not just blindly like try to crack you around.
Exactly. So, but yeah, with children, you see things like, like colic go away, or like sleeping issues go away, or like asthma, ear infections, like double ear infections, like they go away. And like, all this stuff, like how is that possible? Again, it's just removing the interference within the nervous system by adjusting the upper cervical region. That just allows the body to function better. So whatever that baby is dealing with, the baby can only communicate that stuff to me via like crying or like just any symptomatology that's present. But we're not even trying to chase any of that. We're just trying to check, adjust the spine, get out of the way, let the body work better. That's literally all it is. And the way that we adjust children and babies and infants is so much different than the way we adjust adults. So what you see like on YouTube or TikTok about like, the chiropractic adjustment when someone's getting adjusted, that is not what we do for babies, right? So if you can imagine, all right, I want everybody to imagine we have a banana in our hands, right? If you take your pointer finger on your other hand and you go and press on the banana, the amount of pressure that would indent the skin of the banana, but not actually the fruit on the inside, that's the amount of pressure that we're giving via the adjustment for the child. When we're up in the upper cervical region, it's literally just fingertip pressure. It's so light, it's so gentle, it's safe. It's effective, and there's nothing to worry about. We're not twisting and turning the baby's neck, just like they
putting
did,
them on the stretcher,
just like they did when they came out of mom. But it's super safe, and it's a lot different. So it's really really light and gentle for the babies.
Oh, that's good to know. Okay, so I want us to play a little game because there are so many misconceptions with chiropractic that even I want to know the truth on. So let's do a little bit of myth busting. Okay. First one that I have, we have 4 of them. The first one is that chiropractors are not real doctors.
Ooh, yeah, I've heard that time and time again, and honestly, I'm just numb to it at this point because I know that that's not true.
Yeah, your wall of certificates and degrees says otherwise, but I know that we still hear this, so go off.
Right. So as chiropractors are real doctors, we're doctors of chiropractic. We have a very, very almost identical course load to any medical program that you could find at really just about any school in the country. I went through a 14-quarter program, so it was 3.5 years. And throughout that program, I had 5,065 in-class hours. I had 5 national board exams that I had to pass. And I did a postgraduate externship with a upper cervical doc. I could have picked anyone, but big upper cervical guy here. And yeah, I spent some time with him learning more about the field. That was really like my schooling. So the first 2 years were basically like basic sciences where you learn your biochemistry and your anatomy and microbiome and a bunch of like basic sciences and stuff like that. We have a cadaver lab on campus, which I was actually worked in the cadaver lab, which was a lot of fun.
That's cool.
Where we learned just an extensive amount of anatomy from like that's the best source possible, because there's some other schools that they use like this 3D like blown up thing where like a projection where you can kind of slice into. It's cool, but I'd rather work with the actual structures that like we know we are going to be like having an implication on, like through adjusting the spine, nerve flow, all that stuff.
That's crazy.
Definitely hard. Took a lot of time, persistence, a lot of late nights and stuff like that. But the first 2 years are really like the hardest part, if I'm being honest with you.
All the science classes and stuff.
Yeah, just the course load was like, we would literally be there from like 8 to 5 days a week, probably like 7 or 8 classes per day.
Wow.
And it was just like science after science. So like we would spend like an hour in like microbiome and then like switch gears and go to like head and neck anatomy and then like switch gears and go back to microbiology. And
your brain's just fried by the end.
It literally felt like, it was fried. We just lived on like Celsius and espresso.
Did you know you always wanted to be a chiropractor?
That's a story, and I love this story. I talk about this all the time. I was like 12 or 13. I was playing travel baseball, and I woke up one morning and I literally couldn't move my neck. Like it hurt so bad. For those who know what torticollis is, like it felt like torticollis. And I was like, well, Dad, like my neck hurts. Like, like what am I gonna do? He's like, suck it up. Like it'll be fine. I was like, all right, fine. So I play baseball game. I get up to bat. And I literally, like, I square this ball up. Like, I hit this ball, great contact. As soon as I made contact with the ball, I just felt like this, like, electric shock go from, like, my entire neck all the way down my shoulder, down my arm. And it was, like, literally, like, just a burner stinger, like, horrible. And I was like, yeah, Dad, like, I'm done. Like, I can't do this. He's like, okay, like, fine. So he took me to the chiropractor. I had never heard of chiropractor before then. I was like 12 or 13. He brought me in. He checked me. He adjusted me. Didn't feel great, to be honest with you, because I was just in so much pain. Yeah, like, afterwards, like, I felt better. And then I came back, like, 2 or 3 more times just over the next couple days, and then I was like good. I was completely better. I don't know, something about that just like was cool. Like it was cool to me. Like I liked the idea of like what he had done to me. Like it was all natural, like by hand only. Like I was in and out in 10 minutes. Like it was cool. Then I went, I was in high school, bounced my ideas back and forth about what I wanted to do, and then I went to Rutgers to do exercise science up there. And I loved my major, and I knew I wanted to do something with like sports and stuff, but I didn't know where I was headed, So yeah, we had a senior internship program that we had to do like before we graduated. It was like through the exercise science department. When you're picking like where you're going to do your internship at, they gave us like this, it was like an Excel spreadsheet with like 5,000 places in like all the North Jersey towns. In the entire Excel spreadsheet, there was 3 chiropractors. And I just picked the first one, and I called and I was like, hey, like I think I'm interested in like being a chiropractor or whatever. So I went to his name's Dr. Frank Hahn up in Highland Park, New Jersey. Love you, Dr. Hahn. And he really is the one who kind of turned me on to the idea of like what chiropractic truly is and what chiropractic is not. Just the way he ran his practice and all the things he taught me, it really was like a light bulb moment for me, because I knew that I was like, yeah, like this is it. Like this is definitely like what I want to do. Just the way that it's applied, the power that it has, the ability for people's lives to just change drastically. I've always been like a giver. I truly feel like God put me on this planet to give love and serve as many people as I can. Chiropractic is just my outlet to do that. So yeah,
it just clicked for you.
It just cracked for me. No, bad word.
I could say it, you can't.
Okay.
That's a really nice story on how you got into chiropractic, and it's really good to hear that you're in a field that like feels so passionate, and I can feel your passion from over here. And I feel like a lot of people just go into things like, oh, I don't know what I want to do, so I'm just going to do this. And it sounds like you really were intentional about your passions and what you wanted to do. And not only just like what you're doing in your job, but also how you make other people feel and how you're just living out your purpose. And I really like that. Well,
thank you. That's what chiropractic should always be. And when you see forms of chiropractic that kind of don't mimic that, that's when I would say to stay away from them. Just to kind of sum up, we're not medical doctors. We're doctors of chiropractic. And just a major difference, just real quick, between chiropractic and medicine. Medical doctors, or just doctors in general, not talking about chiropractors, they're doctors of certain parts of the body. So if you have problems with your lungs, you'll go to a pulmonologist, right? If you have cancer, you're going to go to an oncologist, things like that, right? So they're parts doctors. Whenever you have a problem with a part of your body, you go to the medical doctor, because that's what they're there to do. They're there to fix the part of your body. The difference between them and chiropractors is that because we're maintaining and optimizing the strength and integrity of the nervous system, right? And since the nervous system controls everything, we're taking care of the entire body. Every time you come in, every time you get your spine checked, every time you get adjusted, we're improving the overall health of your entire body. We're not just looking at certain parts of you. Now, I know you might have headache, and you might have neck pain, you might have back pain. That's fine, but that's not what we're here to necessarily fix or treat or cure, because we're trying to just improve the overall health of your body. That way your body can, on its own, kind of get rid of those symptoms that you're describing.
Yeah, that's a good distinction, and I'm glad you said that. And also, like, I studied public health in college, and we always talked about the continuum of care and how certain aspects, like public health, for example, is all the way on one side, which is prevention focused, lifestyle focused, overall body focused, holistic approach. And then all the way on the other side is medical doctors. Of course, there's a need for medical doctors, but ideally you don't want to see a medical doctor, or you don't usually see a medical doctor until it's already symptomatic, already seeing a lot of problems. And it seems like chiropractor is more in the middle and even more towards like the public health side of you should see a chiropractor even if you're not experiencing back pain and stuff like that. Is that correct?
Absolutely. And just to reiterate, there's a time and a place for medicine. Like if I break my foot, like I'm not going to be like, oh, like my body will heal it on its own. Like I'm going to go get my foot set back in place, and I'm going to get in a cast or whatever. And if I go to a different country and contract something, like I want to fix me, like bring me back to life. You know what I'm saying?
But it's usually that reactive, like something happens, you go see a specialist, you get fixed, and you're good to go.
Yeah, there's a time and a place for it. But no, we love our medical doctors, and we're getting to a point now where we're actually building such a good reputation with the work that we are doing, where we're getting referrals from neurologists and physical therapists and a bunch of family doctors like pediatricians and things like that, where 10, 20, 30 years ago that wasn't really the case. But because of all the research that we do and just all of the proof, and like the proof is in the pudding, like all the results that we get really good results. They recognize that, so they're more open to saying, okay, why don't you go see Dr. Shuemate, we'll see what he can do for you, and come back in like 2 months or something. I don't know. It's nice to see that kind of change in society now, in like the medical community and chiropractic community, because we butted heads throughout history, but that's a different story.
And also, like you said, I think that people are just like waking up a lot more in general. A lot more people are better advocates for their health. They're doing more research. Like as a consumer, people are looking into naturopathic remedies and also broadening their horizons and not just following a medical doctor blindly. I talk a lot about that on the podcast, so I'm really glad you mentioned that.
Yeah.
So let's go into number 2. Chiropractic is dangerous. Myth or not?
Okay, that's another myth. Chiropractic, when performed correctly, is extremely safe, it's gentle, it's effective, and there are little to no risks following a chiropractic adjustment, other than what I will say is some occasional minor associated muscle soreness, which usually goes away after like a day or two. But I always compare that to like, imagine you go and you hit legs, right? And you do like 5 sets of squats. Like you're gonna be sore the next day. Your muscles aren't used to that like load.
And it doesn't necessarily mean you're hurting yourself.
Right, yeah, it doesn't mean you're hurt. So, when you go, let's say you get your neck adjusted, you're not used to having your bones in the proper place. You're used to having your bones in the improper place. So when we take them and we correct the subluxation, we put the bone back into the right place, those muscles are going to follow suit too. So the muscles that are holding the bone, they're not used to being in the right place either. So they're going to be a little bit tighter on one side. And as, the adjustment starts to stabilize a little bit, you'll be fine, and the soreness will go away. If you take a second and just kind of think about, the comparison between, how many deaths per year, right, happen from chiropractic. This is also a little controversial. So medical people, close your ears. It's really just a handful of people every year. It's not a lot of people. And what I will say is the people that do have serious adverse reactions from chiropractic, there's just so many questions that we don't know the answer to. So did they take a detailed case history? Did they take x-rays? Or were they just going in adjusting blindly? Were there any other contraindications for that patient to adjust them in a certain way? What technique did they use? Was everything done and applied correctly and specifically for that patient? Did that doctor do their due diligence when taking care of that patient? And unfortunately, the answer is not going to be yes 100% of the time. There are idiots in this profession. There are idiots in every single profession you can think of.
Yeah.
But when applied, in how it was intended, and if everyone does what they're supposed to do, it's literally just little to no risk. I want to say say zero risk because that's what it will always be for me. We're always going to do the right thing here at Shuemate Specific Chiropractic. I was looking at a John Hopkins study. Every year, there's over 250,000 people in the United States that die from medical error. Nobody talks about that, right? You know, there's no way to say, you know, what they're dealing with. I don't know how those deaths get counted or whatever, but people die, 250,000 of them per year under the hands of a medical doctor. That, it doesn't get talked about. And it's been a top 15 leading cause of death every single year since they started record keeping. What is kind of annoying from like a chiropractor's perspective is because you take a fact like that and you say to someone, hey, do you know how many people like died via medical error last year? Oh no, how many? Oh, 250,000. And then they say, oh my God, like that's so many. But then those same people are like, oh, chiropractic's dangerous. Oh, well, how many people died from a chiropractic adjustment last year?
Yeah.
Like 2? Like, you know, it's never a comparison. So if you want to ask the question, is chiropractic dangerous? You really should be asking the question, is medicine dangerous? Like how safe is medicine in the grand scheme of things? Because nobody really bats an eye when it comes to that stuff. But again, when applied correctly, I'm sure medicine is, you know, I don't even know what to say about it.
Perfectly fine. And we're going to get into it too, because I like that you said, like, there's idiots in every profession.
Right, and there are.
And we're going to get into some red flags of a chiropractor in a little bit. I definitely want to know what to look for. Let's go into number 3. Another misconception is, I don't have back pain, so I don't need to see a chiropractor.
Well, let me ask you a question, Cassie. If you don't have cavities in your mouth...
I don't.
Okay, so do you still brush your teeth every day?
Yeah.
You do? Well, why do you brush your teeth every day?
So I don't get cavities.
Okay, so that's a great idea. You know, we want to, just like you want to maintain the overall health of your teeth to prevent getting cavities, that's why you brush your teeth once or twice a day. So that's the same thing with chiropractic. And your nervous system is far more important than your teeth because it controls everything, not just like chewing of food. We maintain the integrity and the function of the nervous system through checking and adjusting the spine, so that way we don't have these problems later down the road. And it's a funny thing in chiropractic, we like to say all the time, you know, if people wore their spines on their face, they would take much better care of it, because it's true. Like, everybody wants to have nice, pretty teeth, but what are teeth? You know, you just chew food. You know, it doesn't make your heart beat, it doesn't make you digest food, it doesn't make your brain like think thoughts and hormone secretion, all that stuff. Like, no, even if you don't have back pain, going to just make sure your nervous system is working good, that's what we do.
That's so good to know. I love that analogy. And then number 4, our last misconception is that you're only for neck pain, back pain, and headaches.
Right. So yeah, this couldn't be further from the truth. Like, those are 3 little... If our profession literally limited itself to those 3 things, those 3 symptoms, I guess, what would we be? Is that all that we're good for, is neck pain, back pain, and headaches? Like, no, it's so much more than that. We're not neck pain, headache, back pain doctors. We're nervous system doctors. It's only through a fully functioning nervous system that are we able to express our life to our fullest. We don't promise to treat or fix or cure anything that you might be experiencing. All we aim to do is unlock the power that's already within your body, so that way it may heal from above down and inside out.
That's so cute.
Yeah.
That's good.
Now, when we get your nervous system clear and you're fully functioning, you can expect your things like headache and neck pain and back pain and vertigo and dizziness and high blood pressure and sleeping troubles and allergies and all of these things, like so much more than what I just said. But you can expect all those to just naturally subside over time. As your body's functioning better, it's going to figure out a way to get rid of whatever symptoms that you're dealing with. Just know that I, the chiropractor, did not do that. Like, I didn't do that. Like, your body did that from within. I just steered your body in the right direction. That's it.
I like that a lot. Okay, so now I want us to kind of break down a good chiropractor versus a bad chiropractor, red flags, green flags, and things like that. But first, selfishly, I just have to tell you my experience with a chiropractor.
Oh, God.
About a year ago, when I was working at the gym, I was on my feet all the time, like standing all the time, on my feet all day, not really sitting down. And so I started to develop some like SI joint pain, which I guess is pretty common for that. I'm not sure. Everyone was like, you need to go see a chiropractor. And I was like, you know what? I would love to try this out. Let me go. So I go to someone that was recommended to me, this older guy. He had a ton of experience. I was like, he looks good. I looked up his reviews, all that kind of stuff. And I go to see him. First thing he did was put me on a foot scanner and scanned my feet. I was excited for this because I'm like, I've been a dancer since I was 3. I know I'm going to have good feet. Well, it turns out he's like, your one foot is super, super flat. So he's like, you need these orthotics. And I have orthotics. I sell them for $600. You need orthotic shoes. I should have known, like, saying it back to you now, I'm like, okay, obviously he's just trying to sell me shoes. But in that moment, I was believing him because he spent like 20 minutes of my appointment just talking about my flat foot. So he's telling me about orthotics. He's showing me them. And I'm like, honestly, they look like grandpa's shoes, which they do. They're very ugly. So I was like, let me think about it. And then I'll come back. And he's like, okay. So then he takes me to the back. He does a little adjustment, cracks me all around. And then I leave. And honestly, I didn't really feel a lot of relief. And he's like, you got to keep coming back. And I was like, that makes sense. Like, I don't expect this to get fixed over one time. I go back later that week. He just cracks my neck. And if you've ever like been to the chiropractor, they don't usually tell you. They just say, breathe in, breathe out, right. Boom. And then the next day I had all these headaches.
So tell me, is that normal? What are red flags? What are green flags? Let's break it down.
I would love to be there to see that interaction.
I never went back.
You know, the whole like orthotics thing, like from what I've told you already just about, you know, what chiropractic is, you know, what it is that we do. I don't think orthotics fits into any of that, you know, so that's not really, that's not chiropractic. Now, can chiropractors do orthotics and can they do other things because they want to generate more income? And yeah. But that's not chiropractic by itself. I don't know. It just sounds like a money grab to me. And I'm just not a huge fan of that. But what I practice is called straight chiropractic or principled chiropractic. It's just chiropractic, checking, adjusting the spine by hand. That's it. And nothing more, nothing less, and nothing else. Like, that's it. We have other chiropractors. We call them mixers, right? And so at Sherman College, it's like a big thing. Like, we're like the straights versus the mixers. We don't like look down at them, but we kind of like make fun of them a little bit because we know that like they're trying to add all these different things to the profession when you don't need that. Like, you don't need extra stuff. Like, chiropractic was founded on these principles and all these laws that are self-governing, that if you just work with those laws, like, you can get sick people well. Like, you know, you don't need orthotics, you don't need ice and stim and heat and massage and all of these extra things. They're nice and they're fun and some of them feel really good, but you don't necessarily need that. So there was the first thing. Second thing, did he take x-rays on you?
No, the only thing I got was that foot scanner and it ruined my self-esteem. I still have the paper and I think about it a lot.
Well, now you know you have a flat foot.
Yeah, but also, now I also know flat feet can also stem from your hips and everywhere else. And it's not always like, oh, your foot is flat to the ground and you're going to be like this forever. You can develop it and also correct it through exercise and things like that.
That is true. And when you have that, like a part of your body like that that's affected, whether it's your foot or whether it's your ankle or it's your knee or it's your hip, like that entire kinetic chain, when one thing is affected, any of those other things along that chain can be affected. So that's why, here's another great example to talk about this. Let's say like you're having right-sided hip pain, right? You're having SI joint pain. If that's the same side as your flat foot, or even if it's the opposite side, like on your other foot, the pain in your hip may not be from anything that's structurally wrong with your hip, right? It could be just posturally related because of something that's going on with like a flattened foot or like a lessened arch in your foot. So that's why it's not always like, oh, my back, like, or my hip hurts, like crack my hip. Like, no, that's why we check like the entire spine and like see what we find and then go from there.
So is a red flag not doing x-rays?
Right, yeah. So there are techniques, I will say very transparently, there are techniques that you don't need x-rays for certain techniques, especially like instrument adjusting and things like that. So we call it like a tonal model. So it's like super gentle, it's safe, it's effective. And we don't need x-rays for that because the force that we're putting into the spine is so controlled and so small. But if you're using like legitimate by hand adjusting techniques, like whether you're upper cervical like me or you're just doing diversified or Gonstead or Thompson, you want to have x-rays because why would you want to guess with the health of your patient? That's something that I've always kind of just been taught, when I was in school, you don't want to guess with your patient's health and stuff like that. And another quick little thing is there is something that is very important just in the realm of chiropractic that even in the realm of chiropractic doesn't even get talked about a whole lot. Malformations. So the way the spine forms, like in development and stuff, like in utero, especially just nowadays, there are so many bony malformations in the spine. So that is going to affect how you're getting and receiving an adjustment. I've seen plenty of cases, people come in and let's say your atlas is subluxated out to the left. So you think they're a left atlas, you get on the left side of their atlas, you adjust them and like nothing happens or they're not clearing, they're not getting better, they're not holding their adjustments. And you're like, dude, what is going on? Like these x-rays look good, but like they missed something, right? So they missed malformations that are limiting or affecting one's ability to get adjusted. So me, for example, I have a very special malformation in my spine, which is crazy. And I didn't even know this until I got the CT scan. It's a CBCT, a cone beam CT that dentists use them, but now chiropractors are starting to use them too. And it's like a 3D x-ray of the spine and you can see everything. And it goes in slices and stuff like that. It's really cool to look at. In my spine, spine, my atlas, so my C1 is actually fused to the base of my skull. So
What?
my C1 doesn't even move. Like, it don't move by itself. My C1 and my occiput, my skull, it moves as one motor unit. So I get my C2 adjusted. And once I found that out, it was literally like a world of difference. Like, because I was getting my C1 adjusted, which was fused, so like it wasn't even moving.
And you couldn't see that on a regular X-ray?
No, because the shadowing of like the shadowing of the film and the bone and the teeth and all like the hard tissue structures, they overlay on top of each other, and it just makes it hard to see. So CBCT is really the future of chiropractic, but right now you can realistically get probably between 95 and 97%, and probably more, of patients well with just standard X-ray. But if you're not even taking X-rays to begin with, like, you're just limiting yourself.
Yeah.
So I don't know. I would never want to do that.
And
but.
we have so many technological advances now. It's
Exactly.
like, why not use a tool that you have at your disposal if you, like, I don't know, like, that doesn't make sense.
So definitely find a chiropractor who takes X-rays, because, again, we don't want to guess with our patient's health.
That's really good to hear. What's another red flag for chiropractors?
There are what we call Flying 7 chiropractors. They're also called shotgun chiropractors. I don't know where that term came from. But these chiropractors are just, they're not specific in nature. So it's kind of like a one-size-fits-all approach. Everybody that comes in, regardless of their clinical presentation, they're just getting the same thing as everybody else. So we call it a Flying 7 because they'll come in, they'll do your left hip, they'll do your right hip, they'll do 3 mid-back adjustments, and then they'll do your left neck, and then they'll do your right neck.
That's exactly what my guy did to me.
Right. So, yeah. And I don't think that's a standard of care that people should be receiving. So I would just stay away from people like that. Now, does that get some people better? Yes, of course, because all chiropractic works, regardless of how good or how bad the application is. Like, it works well. But we want to optimize that. We want it to be as best as it possibly could be. But yeah, I don't know. I typically would stay away from someone who's just not individualized at all. And like that standard of care to me is pretty low compared to others who actually care about you. And you can tell when you're sitting down with them, the way they look at you in your eye. Like, you can just tell. I mean, growing up, I've always known that. Like, you can tell a lot about someone when you look at them in the eye, like the way they speak to you and like their mannerisms, their body language, like all these like little 1% things that a lot of people just glance over or they're not thinking about it. I can just tell right away. So I would just be open-minded, but also be like a little bit skeptical just when you were going into an experience like that.
Like, if something in your gut doesn't feel right, you should listen to that.
I agree with that for sure.
Yeah.
And I just want to be really clear here. There are good and bad people in every profession and not just chiropractic. And that's why I wanted to ask you what to look out for, because especially if you've never been to a chiropractor, it can be scary, and it can also be like you don't know what to expect. I know for me, I didn't know the difference between a good one, a bad one, doing x-rays, anything like that. Is there anything else that we should be a little bit weary about, where if we go to a chiropractor and this happens, it might not be the best place?
Yeah, I mean, like those chiropractors that will just do anything and everything in the world other than adjust your spine. Other modalities and therapies, like I kind of talked about that a little bit earlier, but just like they try to mix, like they're mixers, and they try to do other non-chiropractic things to try, realistically make more money.
And honestly, I feel like it kind of cheapens your practice because, someone like me who just went to a chiropractor for the first time and the guy's trying to sell me orthotics, I'm thinking that's what all of chiropractic is, when the reality is that's not really the case. And that's a shame for someone like you who is so principled and using the laws of chiropractic and keeping it true.
And what's even worse about like patients' experience with doctors like that is then they don't get good results and then they blame chiropractic.
Yeah.
And it's not chiropractic that was the problem. It was that doctor. There are parameters for developing a care plan for a patient. Cassidy, if you come into the office, based on just what I know about you already, like I probably would not need to see you more than like once every 10 days or once every 2 weeks, like somewhere in that realm.
Okay.
You're definitely not coming in 3 times a week for 6 weeks, followed by twice a week for 4 weeks, and then once a week for 10 weeks, like things like that. Like that amount of volume is so incredibly, it's just frustrating because I know at that point it's not in the patient's best interest anymore. Like it's in the doctor's best interest. That's why like when I'm setting up like care plans, I base it off of one thing and one thing only. How long can I get you to hold your upper cervical adjustment? Because if I adjust you, right, I do my scan. So I have like a neurological scanner that I use to detect interference in the nervous system. So if I do my pre-scan, I see you need to be adjusted. I adjust you. I let you rest for like 5-10 minutes. And then I do my post-scan. And then you clear my scan. So that means you're good to go. Like you are functioning at 100% or as close to 100% as possible. You're going to leave my office way better than you walked in. Now the next question is, how long can I get you to stay that way?
Right.
So after the first adjustment, I have them come back within 72 hours because I need to see in that 72-hour window, did you hold your adjustment or did you not? We call that first adjustment a test adjustment because I'm testing your body to see how long you can hold this adjustment.
Okay.
So then when you come back in, let's say you're holding. Okay, great. I'll see you in a week from now. You come back in a week from now. Now you're out again. Now you need to be adjusted. So now I know between 3 and 10 days, like that's usually how long like you hold your adjustments. And then as you're under care for longer amounts of time, you're going to hold your adjustments for longer amounts of time. I can see you less and less, right?
Right.
So every time you come in, you're getting checked, right? So you're not always going to get adjusted because if you're holding that upper cervical adjustment and your brain sending those signals down your spinal cord across your nerves, each and every single part of your body at 100%, why would I go in and just make an adjustment? Like the adjustment doesn't need to be made. So that's why I always say like we need to check your spine, right? You're getting your spine checked because you're not always going to get an adjustment.
And then do you give your patients like, here's your care plan, I want to see you every 2 weeks, come back, or is it not really like that?
It could be like a formal like thing on paper like that, but I just prefer to do it a little more informally. We just have a conversation about it. Like everything I kind of just told you, like I'll explain that to them.
But you'll explain the long term.
Oh yeah.
Like you're like the goal is I see you less and less and less.
Yes, absolutely.
Like you're gonna
like I literally tell my patients, I'm like, I want to see you as least as I possibly can because that's how I know you're getting better.
Yeah,
that's my goal. Like my goal is to get you well and keep you well. So if you're not coming in a whole lot, like that's because you know, I don't know.
It's working.
Yeah, something's working. But
so then what are the green flags? Are there any like clear signs like, okay, I'm in the right place, here's what to look for?
Green flags, stick with someone or try to find someone that really practices based on like principle. So like just a really principled, disciplined chiropractor who went to a good school, Life College, Sherman College, Palmer, you know, one of those.
Can you ask them like, are you a principled chiropractor?
Yeah, see like that's like so weird. But I think you would just know. Like if you go on their website, here's a good example. Like if you go on like a chiropractor's website and it's like we fix neck pain and we treat headaches and we offer all this extra stuff, right away I know like okay, not so sure about you. But now if I go to another chiropractor's website and it's all like health and wellness and like the power that made the body heals the body. Like you hear that in chiropractic all the time. Dr. Sid Williams. Power that made the body heals the body. The power is already within us. We just got to unlock it. And you hear things like that, and you kind of get an idea. Oh, like this person is just going to be working with my health, like and trying to improve my health, not take away my pain and symptoms. A lot of like family-based practices a lot of them are like that.
Okay, so not the billboard that says back pain.
Yeah, right. Yeah, literally. That's a good example.
Okay.
But if anybody ever needs like a briefing, feel free to shoot me an email and we can have a conversation.
Nice. Okay. So I feel like we had such a good conversation. There's one last thing I want to do with you. I want to start doing it with all my guests, and you're the first one to do it. It's called 3, 2, 1. I want to know 3 habits you cannot live without.
Oh, boy.
2 book or podcast recommendations, and 1 goal or 1 thing that you're working on right now.
3 habits that I cannot live without. The first one, every morning I get up, I get ready, I make my bed. You have to make your bed. Absolutely no excuses. Like it takes 10 seconds. You just make your bed. Because no matter how bad your day was, you can always come home to a freshly made bed.
Oh, I love
Isn't that so nice? Yeah. And those days have happened where I come, man, today sucked. And then like I go up to my room. I'm like, that's pretty nice. Anyway, number 2, first thing I do in the morning, every morning, I've been doing this religiously for like the past 3 months. I take my Yeti, I fill it up with ice cold water, I take some lemon juice, and I take some Celtic sea salt. Just a pinch, put it in there, and that's the first thing I consume like every single day. It just, my organs literally like they all have smiley faces on them. Like they're so happy. And I just feel pretty good throughout the day. And all the pillars of health that like Cassidy talks about, I just wanted to kind of like add chiropractic to one of those pillars. This isn't really a habit, but like I'm definitely not giving up golf anytime soon. Like I just have to golf. Like it's my mental escape. Like it's what I do for relaxation, for fun, but also like creativity too. Like some people don't play golf by themselves. I love golfing by myself. Like I'll literally go out there, I'll spend 3-4 hours just thinking. I'll listen to Cassidy's podcast.
Aww.
I'll listen to wellness, like things like that, like spiritual stuff and whatever it is I'm in the mood for that day. And just use that time to kind of just like debrief from 100 whatever hours in the week.
I love that.
Yeah. Okay.
I was literally going to add golf to your bio introduction. Like I was going to be like, and he loves to play golf, but I didn't. But I wish I did now. Okay. 2 book or podcast recommendations.
Okay. I hate reading. Like I really hate it. But over the past 6 months, I forced myself to read. One book that really kind of changed my perspective on a lot of things was the 48 Laws of Power.
Yes.
That was a really, really powerful book. And I wouldn't even I didn't want to try to read it all at once because I would just read a chapter a day. I read a chapter a day for 48 days and because I wanted to actually read that chapter and sit and think about it and what each of these things was talking about and how that related to my life. A lot of these life things actually started happening and I recognized it from this book and I was just better able to handle certain situations. I became a lot stronger, a lot more confident. Number 2 is a podcast and it's called Wake Up Humans.
Ooh.
So Wake Up Humans is a chiropractic podcast by Dr. Steve Judson. He is up in Connecticut and he's a great guy. He does similar work. He's upper cervical like me. He lights a fire under you and gets you wanting to get up there and just kick butt at life. You'll have to just listen to it. And they're short. They're 3-4 minutes, some of them.
There you go.
Wake Up Humans.
I love that. And then what's one thing you're working on right now?
Other than building up my business that I just started a couple months ago, just working on talking about chiropractic to people better. Speaking about chiropractic in ways that people can understand and relate to on a much more personal level. When I was going through my internship, I literally would get A+ on every single category of the 20 things that had to be checked off except for the communication part. So
really?
Yes, and ever since then.
And I think you're such a good speaker.
Well, I don't know. I just try to I try to give them what's just in my brain. But sometimes it just can be I talk too much or I go on tangents or the content is too difficult. But I'm not trying to
over your head a little bit.
Something like that. But that's just one thing.
Well, this was a great place to start then.
It was a great place to start. Yeah, I had a lot of fun.
Well, thank you so much for being on the podcast. I feel like now I definitely need to get my spine checked by someone that's principled and does x-rays and does everything right.
Very good.
Promote yourself to everyone listening, your business, where to find you, how they can get in contact with you. Go off.
Okay, so I just opened up my office in Minnetonka, New Jersey. So it's called Shuemate Specific Chiropractic.
I'll have it all linked down below as well.
But you can also go and follow me on Instagram. It's Shuemate Specific Chiropractic as well. All my information is there as well. And look forward to seeing you guys in the office. Getting your spine checked.
Yeah, go get your spine checked. He'll crack you up.
Oh, there it is. All right, it's the last time you get to say that.
Thank you so much for listening. Follow the Instagram at NerdyandFlirtyPod and me at Cass Camp. Give it 5 stars and nothing less, and share it with a friend who you think needs to get their spine checked. According to this episode, that is everyone. So have a great day. I'll talk to you next week. Bye.